Starting by showing my area. Okay. Hi, my name is Lauren. I'm an FNP student. I'll be examining you today. First, I'm going to start by inspecting his skin head to toe for temperature, turgor, texture, moisture, bruises, scarring, lacerations, media, and symmetry. The head is midline and symmetrical. I'm going to palpate and inspect the head and scalp, noting any masses, deformities, tenderness, noting the hair color, texture, and distribution. I'm going to move down and palpate the temporal arteries, the carotid artery one at a time, and auscultate those for bruit. No bruits heard. Next, I'm going to inspect the ears for position and symmetry. I'm going to palpate the pineum and the tartarus for any masses, deformities, or tenderness. I will examine the auditory canal, noting the tympanic membrane, which is white and pearly gray. Going to assess hearing. First, cover the opposite ear, please. Repeat what I say.
1, 2, 3.
The other side.
ABC.
Tell me if you hear this equally in both ears.
Yes.
Okay. And tell me when you can no longer hear this.
No.
And
No.
the opposite side.
No. No.
Air conduction is greater than bone conduction. I'm also going to go ahead and assess for vibratory sensation over the posterior ulna. See this one? The opposite side. Same.
Yep.
And the medial radialis.
Yep.
Next, I'm going to palpate the sinuses, the frontal and maxillary, noting any masses, deformities, tenderness. I'll palpate the preauricular, postauricular, occipital, tonsilary, submandibular, maxillary, and subclavicle. I will inspect the eyes, noting the sclera conjunctiva, as well as the lashes, eyebrows, and palpebral fissures. For the eyes, look straight ahead. Noting that the eyes are, or the pupils are equal, reactive, and responsive to light. While I have my flashlight, I'm going to go ahead and inspect the mouth, noting the tongue, teeth, gums, floor, palate, roof of mouth, posterior pharynx, uvula, open wide, stick your tongue out, side to side, lift it up, say ah, stick your tongue out. It's cranial nerve 9 and 10, noting the uvula, and tongue rise with phonation. I'm also going to go ahead and assess his visual acuity. Cover one eye, and what is the lowest line you can read?
Z4 TV.
Cover the opposite eye and read the lowest line.
Z4 TV.
Looking at 2020. The tongue was also without folliculations, and that is cranial nerve 12. For the eyes, focus here and follow it. And now focus here and then my finger. Good. Eyes accommodate. And now I'm going to test the ocular eye movement. Follow, please. Noting any extraocular movements. Going to assess peripheral vision. That was cranial nerves 3, 4, and 6. Peripheral vision.
No.
On this side.
No.
And that's cranial nerve 2. I'm going to look in the eyes for his corneal red reflux. And the nose, noting that it is midline and symmetrical, going to test for patency. Close one nostril, breathe in and out, and the other. Good. I'm looking for any signs of respiratory distress, including nasal flaring, use of accessory muscles, tripod positioning, cyanosis. I will examine the skin and symmetry of the neck, noting color, temperature, texture, turgor, scarring, lacerations, bruising, nuvium. I'll palpate the trachea, his midline, as well as the thyroid gland. And shrug your shoulders for me. Cranial nerve 11. Neck range of motion. Could you flex your neck down? Extend, hyperextend, and all around, lateral, side to side. Okay. And the posterior chest, noticing the skin color, texture, temperature, turgor, scars, lacerations, media, symmetry, deformities. Skin is clear, symmetrical with no obvious deformities. I'm going to assess for chest expansion, breathe in and out. Chest expansion is equal. I'll test for egophony. Need you to say EE.
EE. EE. EE. EE.
Say 99.
99. 99. 99. 99.
I'll also listen for the 9 areas of the lungs, starting below the clavicle. With the bell and the diaphragm, same locations. going to percuss, noting any tympany, dullness, flatness. Go ahead and test for CVA tenderness. Tell me if there's any tenderness.
Nope. Nope.
Just going to palpate the anterior chest. First, I'm going to inspect the skin for color, texture, turgor, bruising, scarring, lacerations, nevia. I'm going to auscultate the lungs, bell and diaphragm. And the heart valves, starting with the aortic, second intercostal space, pulmonic, second intercostal space, Erb's point, third intercostal space, fourth intercostal space, tricuspid, fifth intercostal space, midclavicular line, the mitral valve. It's also where you would listen for an apical pulse for 1 minute, noting the rate and rhythm. That's also the PMI that I'm palpating for. Going to assess for deep tendon reflexes. The first one will be the brachial radialis. On both sides. The patellar, Achilles, patellar. And the Babinski negative, deep tendon reflexes are 2 plus on locations bilaterally. Go ahead and recline for me. I'm going to inspect the contour and symmetry of the abdomen. I'm also going to look for any lifts and heaves. I'm going to go ahead and auscultate a couple different locations, including the cardiac, again, all 4 quadrants of the abdomen, and the arteries. The aortic, pulmonic, Erb's, tricuspid, mitral, auscultating the quadrants, normal active bowel sounds, and the arteries, be the aortic, renal arteries, iliac, and the femoral arteries, noticing any bruits, lungs clear, posterior, anteriorly, bilaterally, equal, Heart sounds S1, S2 heard, no S3, S4, murmurs, gallops, normal active bowel sounds, no bruits. I'm going to percuss the abdomen. For tympany, dullness, flatness, I'm going to assess the neck. For JVD, while he's at this angle with no JVD, I'm going to palpate the abdomen. Tell me if there's any pain or tenderness.
No.
Noticing any masses, tenderness, guarding. All right. You can go ahead and sit back up. And I'm going to start with the upper extremities. First, you see your hands. I'm noticing the skin for color, texture, temperature, turgor, bruising, scarring, nevia, as well as the joints for redness, edema, swelling, deformities, nodules, tenderness. He has cap refill less than 3 seconds. Squeeze my fingers. Grip strength +5 equal bilaterally. Radial pulses +2. Fingers, can you flex, extend, hyperextend, abduct, thumb opposition. Go ahead and do all fingers for me. Hands on knees, back and forth. Good. Going to the wrist, palpating, inspecting, redness, swelling, edema, deformities, masses, nodules, tenderness. Wrists, can you flex, extend, rotation, ulnar deviation, radial deviation. Good. Elbows, inspecting and palpating for redness, swelling, deformities, masses, tenderness. Elbows, can you flex, extend, hyperextend, and pull up with resistance, bend, flex up, and push down. Those are equal bilaterally. Shoulders, straight your shoulders up, cranial nerve 11, noticing and inspecting, palpating for any deformities, crepitus, nodules, tenderness, masses, deformities. For your shoulders, can you flex, extend, hyperextend, internal rotation, external rotation, abduct, adduct. Lift your arms again, pull down. All right. Strength is +5 equal bilaterally. All right, moving on to the lower extremities. First, we're going to inspect, palpate the skin for color, texture, temperature, moisture, bruises, scarring, lacerations, nevia. I'm looking at his toes for any redness, swelling, deformities, notches, crepitus, symmetry. Cap refill of his toes is less than 3 seconds. Can you bring your toes up, point your toes down, open, abduct, adduct, and push down, lift up. Okay, both of those are +5 equal bilaterally. Moving to the ankles, inspecting and palpating. Can you flex, extend, internal rotation, external rotation, circumferential. Okay, noticing the dorsalis pedis and the posterior tibial pulses to be +2 equal bilaterally. Inspecting and palpating the knees for any redness, deformities, crepitus, tenderness, masses, swelling. Knees, can you flex your knees, extend? Okay, other side. Good, and with resistance, push out, pull back. Okay, strength equal 5 by 5 bilaterally. For your hips while you're sitting, can you abduct and adduct And then with resistance. Good. Other side. Good. And with resistance. Okay. Those are +5 equal bilaterally. Go ahead and stand up for me. Turn around. Standing up straight, I'm going to inspect his skin, palpate the spine. Can you flex forward for me? Flexion, noticing any scoliosis. Stand up straight, extension, hyperextend all the way back, lateral to the sides, and rotation to spin the other. Spin your top, spin your top, and good. Go ahead and turn back around. Close your eyes for me. From the wrong bird's test, noticing any kind of movement. He has none. With your eyes closed, I'm going to go ahead and assess a light touch all over. Tell me where you feel this.
Cheek, hand, toe, leg, arm, forehead, other cheek.
Okay. And let me see your hand while your eyes are closed. What shape is this?
Circle.
And this hand, what letter is this?
B.
What object is this?
Paperclip.
Correct. And this hand, what object is this?
Pen.
Okay. That would be sternogenesis and graphesthesia. Go ahead and let me assess your gait. Walk from here to there, please. On your way back, do heel to toe. All right. For your hips, can you flex, extend, hyperextend, rotate, adduct, adduct? Good. And the other leg, same thing. Extend, flex, hyperextend. Okay. Abduct, adduct, rotation, internal, external. I'm going to inspect, palpate the hips for any redness, swelling, deformities, nodules, masses. Can you stand on one foot, hop, and the other foot, hop? Good. Go ahead and have a seat again for me. All right. Clench your teeth. I'm going to assess for cranial nerve 5 as well as T and J. Okay, can you smile, frown, puff your cheeks out, purse your lips? And that's cranial nerve 7. They're all symmetrical and intact. And I believe this concludes our assessment. Thanks.